Okay, so thanks everyone for joining today. We are going to do today a talk from the Antimicrobial Stewardship Program, and I want to talk about, this is kind of a proud moment for us. We had a paper that was published earlier this year, earlier in the spring, and so we want to talk about that because I think it's about the viral prescription pad in essence, and with cold and flu season coming up on us, complicated with COVID and all of that stuff going on. I just think it's a very good moment to talk and remind people about some of the tools that are in our antimicrobial stewardship toolkit, particularly with primary healthcare. So I encourage anyone who's watching this, particularly clinicians, that you reach out to your primary healthcare partners, and you can share the video once we've recorded this. We'll have a link set up for it. We can send that out. But certainly encouraging any primary healthcare clinicians, prescribers particularly, to make use of some of the antimicrobial stewardship tools that are available, particularly when we get into flu seasons, to help reduce the number of unnecessary antibiotic prescriptions that are going out. So with that, I'll get into the presentation. So basically what this comes down to is we have a problem with overuse of antibiotics, particularly in primary healthcare, in primary healthcare and particularly with upper respiratory tract infections. And so we have to do something about this issue in order to be stewards, in order to do what is antimicrobial stewardship. So I want to talk about kind of how we came to do what we do with our stewardship program. And so it started with kind of, needing to understand what we know. So with antimicrobial use in primary healthcare, we know that in Canada, and this is data from our Canadian Antimicrobial Resistance Surveillance System report, so the CARS report, this was their 2020 update. We know that in Canada, the majority of antimicrobials are used in the community setting. So that's 90%. That's what those blue bars are there. 90% of our antimicrobial use is in the community setting. And we know that with community antimicrobial use, a lot of it is due to unnecessary prescriptions. So this data here comes from the CDC in the US, and they had done some work in this was published in 2012. But this came from a lot of work that they had done where they were looking at what prescriptions were being prescribed for in community clinics, outpatient, like emergency rooms, stuff like that. And so they found that of their antimicrobial prescriptions, minimum 30% were being prescribed for unnecessary indications. So at least 30% were being prescribed for viral infections, things where an antibiotic is not indicated, asthma, things like that. So just things in general where, an antibiotic is of no use. And that was their low estimate. So that number could be as high as 50%. So anywhere between 1 in 3 to 1 in 2 antibiotic prescriptions in US outpatients at that time were deemed to be totally unnecessary. And then the other chunk of that pie, so whether that's 50 or 70%, depending on what the first part is, those were at least necessary prescriptions. So they were prescriptions being provided to people who actually have a bacterial infection, but there's still room to improve the drug selection, the dose, and one of the big ones is the duration. So that's one of the big things that we generally talk to people too is duration of antibiotic therapy. So we know that in community, we use a lot of antibiotics. The majority of our antibiotics are used in community, and it's unlikely that this data from the US is really any different in Canada. And so it's likely that, at least a third of our antibiotic prescriptions are probably going out for totally unnecessary reasons. And then when we look across Canada to look at kind of how much we use in the different provinces. So if you count the Maritimes as a group, so on this graph here, you can see we're seeing the total amount of antibiotic use. So this is defined daily doses per 1,000 inhabitants. So amount of antimicrobial use. And then they broke each bar into sort of the top 5 different, top 5 classes of antimicrobials and then all others. But if you combine sort of New Brunswick, Nova Scotia, and PEI and Newfoundland together, which they used to do in these reports, that was the number one in terms of the highest use per capita of antibiotics. And so that puts Saskatchewan at number 2. So if you do kind of the same thing, we're really the second highest user of antimicrobials in Canada per capita kind of thing. And so probably not a silver medal that we want. And to me, this shows that we definitely have room for improvement in terms of our antimicrobial usage. And so where does this lead? If you're using a lot of antibiotics and a lot of them unnecessarily, what could that potentially lead to? And so here, again, data from the US showing that really the more antibiotics we use, the more antibiotic-resistant bacteria we see. And that's a well-known piece of information. So what they show here is the months of the year along the bottom, and in blue, we see the penicillin prescriptions. And so you can see in the winter months, January, February, March, on the left side there, they're relatively high. People have colds and flus, and they're going to the doctor and getting their antibiotic prescriptions. And then in the summer months, people spread out, and we have less. The cold and flu season goes away. We have less person-to-person spread. And then we get to September, October, November, school's back in, everyone crowds together back in their houses, and we see increased use again. People are getting sick, and they're going to the doctor and getting more prescriptions. Now, the interesting part of this graph is the orange line that goes along with this. And so this is the resistance to those penicillins in E. coli. And so you can see there's about a 1-month lag in the peaks, but it follows the same pattern. So when we're using a lot of antibiotics, we see high resistance among those bacteria. And when we use fewer antibiotics, we see less resistance among the bacteria. So we can affect the resistance rates in our communities by how much antibiotics we use. And so again, in Canada, to look specifically, so in 2018, this is data that comes from, there was a big report that was released called When Antibiotics Fail, the expert panel on the potential socioeconomic impacts of antimicrobial resistance in Canada. So a bunch of smart people put their heads together and sort of came up with some numbers to kind of give an idea of what it would mean to be having to deal with sort of massive amounts of antibiotic resistance. So in 2018, when they looked at this stuff, there were about 980,000 bacterial infections in Canada. And of those, more than a quarter, so 250,000, were infections that were from antibiotic-resistant bacteria. Of those resistant infections, so of those 250,000 infections, 14,000 people died. And of those 14,000 deaths, 40% of them would not have occurred if the infection was susceptible to first-line antibiotics. So you can see that this is not something that is inconsequential to people. Like, antibiotic resistance is a real thing that we are dealing with, and it kills people every year. And it is, somewhat unnecessary to have the numbers that high. If we're doing a better job of using antibiotics appropriately and seeing less resistance, we should see less people dying from antibiotic-resistant infections. So with all of that in mind, when we started our antimicrobial stewardship program in Regina, the question was, okay, so what do we do in primary healthcare? If we want to focus or have part of our focus be in primary healthcare, what exactly can we do to ensure that we're tackling this problem? So obviously, having an antimicrobial stewardship program working in primary healthcare in the first place is a big piece. Understanding the surveillance, understanding what's going on. So having consistent data collection, reduced barriers to data access, getting prescribers to participate in whatever you're doing, audit and feedback, changes to pay structure, so on. It goes on and on. You can see the list there. But these are all the things that kind of were in our heads when we were looking at, well, how are we going to do antimicrobial stewardship in primary healthcare? How are we going to try and make a dent in this potential problem? So that's the story I want to tell you about. When we ask where do we start, this is kind of where we started. And so I'm going to go based off the paper that we published here. So this was the viral prescription pad, a mixed method study to determine the need for and utility of an educational tool for antimicrobial stewardship for primary healthcare. So basically, we're trying to understand, what do people want to do antimicrobial stewardship in healthcare? And when we provide the things that they want to do, are these something that are effective? And so a big piece of this is going to revolve around that viral prescription pad, but of course there are other tools and things that we have. So you can see the author list there, and it was published in BMC Family Practice earlier this year. So, like any good story, a long time ago, in a barren office in East Regina, there toiled a high-spirited team who set out on a quest to save the people of Earth from the scourge of vile antimicrobial-resistant superbugs. And on the first day, the powers that be in the Regina Capel Health region at the time sent on to Bob Parker, go forth and create an antimicrobial stewardship program. And so he did. And he hired these two angels, and he said, we're going to make an antimicrobial stewardship program. And we said, okay, what are we going to do? And so we came up with the idea, well, based on everything I talked about, maybe we should do something in primary healthcare. That sounds like a good place to do something. And so again, the question was, okay, well, then what? I mean, there's a number of different things we could do. So where do you even start? And so what we decided was, well, let's see what the actual healthcare workers think is important. And so we wanted to ask primary healthcare providers, if we were to adopt an antimicrobial stewardship program that worked with primary healthcare, what would you like to see as part of that? What pieces of the puzzle do we need to put together in order to make that a success? So the first part of this paper talks about that survey that we did. So in May to August of 2016, we performed a survey of various primary healthcare providers across the province. So that included family physicians, nurse practitioners, dentists, and community pharmacists. I'll just mention we did also interview or survey veterinarians, but I just haven't included that stuff here because it's not as relevant. But we wanted to ensure when we were even looking at this that we were sort of taking that One Health approach and getting everyone's pieces of the puzzle together. So I guess there were a couple of differences here too. So the family physicians were just from the former RQHR. So there were 219 surveys that were sent out, or invites that were sent out. The nurse practitioners were the same thing. So there were 40 in our local region. The dentists and community pharmacists we sent out through their respective societies. So that went provincial. So there were a larger number of people who could respond there. And in the end, you can see the total there. We had 234 responses out of a potential 1,855, so about 13% overall. Which seems to be on par for any kind of survey. People just aren't that interested in doing surveys, but at least we heard some people's voices, and certainly the people who are probably most passionate about a cause like this, and people who would likely to be involved with us in the future. There is further demographic information available in the paper, the split between male, female, how long they were working in their careers, and age ranges, I think, that kind of thing. But it's not as relevant to this, so you can explore that on your own if you want. What I do want to talk about is the, I see Bob has fired me for that picture. I covered you up with the leaf, Bob, so that'll be nice to me. What do healthcare workers think is important? So we had a number of questions in the survey, and I just want to highlight a few of them that sort of led us down the road to where we are. So one of these things, we asked them to respond to various statements about how much they agreed with them. And then we broke it apart by the different groups. So you can see dentists, nurse practitioners, pharmacists, and physicians. And this was the percentage of agreement in green versus disagreement in red. So we had a Likert scale that we broke down to whether you agreed with us, or you agreed with the statement, or you disagreed, or kind of had no opinion. So the first one here was, I believe the public needs more education on the correct use of antimicrobials, for example, through school curriculums, advertisements, etc. And as you can see, the vast majority of each group thought that, yeah, this is an important piece. If we're going to do antimicrobial stewardship, we need to make people aware of, proper use of antimicrobials, the problems of antibiotic resistance, those types of things. And so that's something we've incorporated into our program. So we go out and we've been doing presentations to the public. There's some examples here of high school presentations and elementary school. And as I was saying earlier, this is something we're even doing. I have back-to-back presentations bracketing this particular one with some health science classes at Johnson. So a great opportunities for go out. And you can see by all the happy faces, everyone's super thrilled and loves our presentations. The next one, the next statement was, I possess or have access to the necessary tools or resources to educate my patients about antimicrobial drugs. So basically asking them, do you feel like you've got all the tools necessary to have those conversations with your patients and help them understand the proper use of antibiotics? And much less agreement on that one. So you can see only up to, I think it was 58% amongst nurse practitioners there agreed that they had the necessary tools. So that took us down the path of creating some of these. So the viral prescription pad is one, and there were a number of others. This was certainly one of the ones that we really tried to promote, and I'll come back to that in more detail as we go on here. And so the last piece then is I would attend an educational session, seminar, workshop, online education, whatever, that provides further information about antimicrobial stewardship. And you can see again that, more than 80% of each category agreed with that statement, thought it would be great for themselves as clinicians even to get more information. And so that's, again, we're here right now. That one of the reasons we have this ongoing monthly session is to help fulfill that need amongst our community clinicians that, hey, let's get more information about antimicrobial stewardship, even for clinicians. And another piece, too, that I'm pretty proud of with our group is the Western Canadian One Health Antimicrobial Stewardship Conference. So in the late, I think it was November of 2017, we had sort of a provincial kind of antimicrobial stewardship thing that we all got together in the province and started to try and push some of this stuff forward. That morphed into what this poster was here. So our Western Canadian One Health Antimicrobial Stewardship Conference that took place in January of 2019. And then the second iteration of that was to happen in Edmonton this past spring, which kind of got pushed back with COVID stuff. So that is now scheduled for next spring, and they've been looking at virtual things. But anyways, the point is, it's we've really tried to bring together the community and are trying to find ways to bring together the community, at least in Western Canada, to have a forum to talk and discuss and do this across, whether you're in human medicine or animal medicine or environmental health, all of that stuff is relevant. So to concentrate then on some of those educational resources. So one of the big ones for us was developing this viral prescription pad. And you can see an example of it on the left there. If you're not familiar with it, basically what it does is it is something that clinicians can use so that when they have a patient who arrives with a viral infection like a cold or a flu or something like that, they can essentially check off a box here and say, yeah, I definitely agree you've got a common cold. So check this off. It'll tell that patient, you know what, you could expect 7 to 14 days of symptoms for your average cold. And then you are not going to get an antibiotic because they're not effective for treating this. So that's kind of where the clinician can then have that conversation with the patient and help them understand. And here's things they can do on, as you go further down about how they can treat their symptoms, getting rest, washing your hands frequently to prevent spreading. If you've got fever, take, painkillers, lozenges for sore throat, all that kind of stuff. And then, if you don't feel better after a certain number of days or you develop a high fever, then you can give them reasons why they might want to seek care again. So we developed these. We went through a bit of a process with various clinicians, pharmacists, and family docs and things like that in Regina and elsewhere, and settled on sort of this document here, which we then printed off and distributed with the help of some of our partners in primary healthcare, along with education about what the intended use was. So it's not like we just put this in their hands and walked away. We said, here's a viral prescription pad. Here's how you use it. Here's what it's meant for, those kinds of things. We made it available on our website so people can download electronic versions of it. As I said, we printed off paper pads and had those delivered to clinics in Regina with much help from our primary healthcare team. They did a bit of a Christmas blitz that year. And then we also made them available to embed in people's electronic medical record systems so that if they don't want a pad sitting on their desk, they can have it right there, an electronic copy in their EMR, which they're generally working in anyways. But the big question remained after we sort of distributed them, are people actually using them? I mean, we created this tool that we think will help, but we want to know if it's actually going to be used. So that led us to the next piece, which was, well, why don't we just ask them? So we did interviews with physicians, primary healthcare physicians, from November 2017 to May 2018. Public Health Agency of Canada helped to fund this work. And we had 12 family physicians from Regina that were interviewed by what we called an external research assistant. So this was someone who was hired that had no involvement in the development of the viral prescription pad and other tools. And so we figured that might be a good opportunity to have someone come in from outside, so to speak, and do these interviews so that people can feel free to speak openly about, if they didn't like the tools or that kind of stuff, if they had negative reviews for them. So we had, about 20 to 40-minute interviews, covered a number of educational interventions that had been introduced over the previous year, which included the viral prescription pad and other informational handouts that we had, as well as an audit and feedback program that we had started. Oops, wrong way. And so just to highlight a few, again, these are just quotes that are in the paper there anyways, but one common theme that came back was people thinking that these were a useful tool for educating patients. So participant D here saying that I think there's nothing I don't like about the viral prescription pad. It does help. I use it for 50% of my patients. So for those who've already been to one clinic and then are coming to see me, I feel they need something to be convinced. Maybe the other doctor has told them, but they still need that second opinion. So these are the ones that I use the pad for. Another theme was patients. It seems to help patients feel like they're heard. So here participant B was saying, we can write specific instructions to them so that they know we're not just dismissing their symptoms, but we recognize that they're having a tough time and that they don't need any antibiotics. So here are some things that you can do, some reasons to come back and see me, and they thought this was great. Another theme was providing something tangible for their visit. So kind of in line with helping the patients feel that they're heard, but that they actually have something to leave with. So participant W here saying the patient is walking away with something. It's not just the patient coming in and you say, no, it's a virus, go home. I think they'll feel more like they actually have come to see a doctor. You gave them this and everything is filled up, and they can see that it's also coming from the health region or the health authority. So it's not just some random doctor telling them not to use an antibiotic, but this is kind of like an official document. And sometimes people leave the office and they don't remember anything that you said, but if they have that prescription, they're able to refer to it. So they can refer to those, how to feel better, make your symptoms go away, that kind of thing. They said, I like the idea that patients leave us with something that's informative and in the style of a prescription. So that was great. We got lots of great feedback about the viral prescription pad specifically. One interesting thing that also came up was that some clinicians chose not to provide the handout. So they said, I have a good relationship, with my patients. They trust me. Participant P here was quoted as saying, I usually tell patients this information verbally, and I don't know how much this viral prescription pad really adds, to be honest, to what I already tell them. And so we thought that was interesting because, again, the whole purpose of these pads was to help have that conversation with patients and ensure that patients are getting all of the information as well, not just to help necessarily walk a clinician through how that conversation could go. So we did one more research project where we did a survey of the general public to ask patients what they thought was important when they had a visit. So we did a survey of the general public from November of 2018 through May 2019. It was done online using RedCap. We disseminated the survey through both advertising posters, which were sent out to primary healthcare clinics in Regina, and then myself and the other investigators shared the links through our social media accounts, so Facebook, Twitter, LinkedIn, just to try and get the word out there because we were interested in really anyone in Canada who had an opinion on the subject as a patient. And so the survey itself focused on preferences for receiving information when seeking care for an upper respiratory tract infection. So we're kind of trying to steer people towards when you're going to the doctor for like a cold or flu, how do you like to get your information? So again, demographics here. This one is a little interesting. So we had 79% of our respondents were female. The majority of them, 93%, had their own family doctor as opposed to using a walk-in or emergency room. So we thought that might be an important piece. And then we were quite skewed in terms of the level of education completed of our population. So 89% had some level of post-secondary or graduate education, which I think is compared to about 25% in the Canadian population more broadly. So a few pieces I just want to highlight from that last study then. We asked people, when receiving information about symptom management for an upper respiratory tract infection, do you prefer, and they could choose either printed information, verbal instructions, or both printed and verbal instructions, which you can see at 66% was the highest chosen category. So most people, 2/3 of people like to be told, this is how you can manage your cold, and here's something printed. So like you say, you can go home with the, how to help your symptoms go away and that kind of thing. So they have something to refer to. We asked them specifically about the viral prescription pad, which we put an example of in the survey, and asked them if they would prefer having a handout like this one, like the viral prescription pad, particularly given to them by their care provider when they're diagnosed with an upper respiratory tract infection. So 30% said, yeah, they'd be happy with that. Again, 2/3 or 65% said, sure, the viral prescription pad is great, but I'd also still like to have verbal information. And 6%, I guess, just did not like the viral prescription pad at all and said, no, I do not want this. I don't know who those people are, angry people. So then what we wanted to do was kind of take some of these responses that we had and sort of see where all these people meshed if you sort of put them into a crosstab. So along the top here, we have, when you receive care from a primary care provider for an upper respiratory tract, are you provided with printed information for symptom management? And they could choose never, rarely, always. And then on the side, same categories, but it's, do you receive verbal instructions? And so you can see in the bottom left-hand corner here that 49%. So 49% of respondents never receive printed information, but sometimes or always receive verbal information. The bottom right side, that category there is 21% if you combine those four together. And those are people who sometimes or always receive printed information and sometimes or always receive verbal information. And then, I mean, up in the top left here, there are 2% of people who said they never get verbal information and never receive anything printed. So I don't know what doctors those people are going to see. They may not be doctors, but interesting to see those come out anyways. And so the last piece is this, when we take a look at the percentage of patients who said they would prefer printed information or a combination of printed and verbal information. So if you look back at A, that's that 66% who said they would prefer both, and the 10% who said, yeah, I would like printed information. So of those people, 74% rarely or never actually receive printed information during their visits. So this is kind of where this got interesting for me. So we had, people saying, oh, I have good relationships with my patients and they trust me. I don't need to give them the verbal information. I tell them this stuff anyways. They don't need the printed information. And so what we've got here is a population who mostly sees their family doctors. It's not a high percentage of people who are going to walk-ins and emergency rooms and stuff like that. And so seemingly, regardless of their reputation, of their relationship with their provider, they are wanting to receive printed and verbal information, and yet rarely do. So, this was an important part for us to take back to clinicians and say, despite what you may feel about your relationship with the patients, it's important to have that conversation. And, if there's an opportunity, offer them, hey, here's some more information. Would you like it? They can certainly turn it down, but I think it's something to just for clinicians to consider when they're thinking about these types of tools. So yeah, all of this came together. Of course, after a research project, you want to get that information out there. So we put it together in the paper. And that's available for anyone. It's open access, so you can check that out. We'd love to hear your feedback on it. And I just want to give a little kind of overview of the viral prescription pads journey. So where this went from sort of 2016 when we had initially developed this was what it looked like. RX Files here in Saskatchewan got a hold of it, and they put their own spin on it. So give it a bit of a different, aesthetic a facelift, I guess, and kind of bit of a different layout. That has been adopted by Choosing Wisely Canada, so you can find this on Choosing Wisely Canada's website, which is great to have this kind of stuff promoted by a national group like that as well. The other cool thing that RX Files did was they adopted this into, I think, 12 or 13 different languages. So again, these are all available on their website. But if you have patients then whose first language is not English, there's a great way here to still have a tool that you can use to help communicate with them in their first language. So this one's Arabic as an example. We have recently also adopted this to be a pediatric one. So obviously everything here is for adult patients, and there are slightly different recommendations for children. And so we've adapted this, and we kind of vetted this through some of our pediatricians here in Regina to get an idea of, or to put something together that people can use for when they're, not wanting to prescribe antibiotics for a child age 6 to 12. Again, something that obviously when working with the parents, but to give the parents something to, again, help them figure out how to manage their child's symptoms and, symptoms to watch for, things like that. Another thing I'll make a note of here too is the delayed prescription. So if you have a patient who, they're maybe quite adamant that they need a prescription, or you're not 100% sure, this may or may not be something that's viral or bacterial in nature. Or you have a patient where it's simply like, come back in 3 days, we'll check you again and see if this has progressed, if we need to start an antibiotic. Then you have and then maybe they can't come back to the clinic. This gives you an option to say, okay, here, I don't think you need an antibiotic. I think this is probably viral and will go away on its own. If you haven't felt, in the next few days, if you haven't started feeling better, then you can go and fill your prescription. So again, this is something that has been shown to be useful for helping to reduce the number of antibiotics being prescribed for likely viral illnesses. So I will stop there. I will give some time for questions. There is here, I'll just make note that there are the links there for any of the different tools that I put on the screen there. You can certainly email us any questions at antimicrobialstewardship.saskatchewanauthority.ca. And I wish everyone luck and health in the upcoming flu season as we try and navigate through this together. So I will stop sharing my screen there. And if there are any questions, you can feel free to unmute yourself and ask, or absolutely feel free to type into the chat box and send them there. If there are no questions, then, like I said, please feel free to connect with your primary healthcare colleagues and spread the good word. Like I said, these are available on our website, all these tools, and people can make use of them in the upcoming flu season. Hopefully we'll together be able to provide fewer antibiotics to people who don't need them. Thank you all very much for joining.